Welcome, welcome, welcome to this live. I haven't been live on YouTube in over 2 years, and apparently I need to get up on my technology. But I'm glad you're here, and we're going to look at something specific, frozen shoulder, which I have seen in clinic a lot. But what's interesting about this is that all the patients that I've seen over the years coming in with frozen shoulder were all women. I've never seen a man coming with frozen shoulder. That's really weird. I'm sure it happens, but I've never seen it in my practice anyway. And they were all between 45 and 55 years old. And I started seeing a little bit of a correlation that this was happening as the woman was going through perimenopause and menopause. And it made me pause and look at it from a perspective of, wait a minute, this is kind of interesting. What is happening? And I went and researched a little bit more. So today we're going to talk about frozen shoulder protocol, how we can help patients, because conventional medicine doesn't help a lot. They basically will tell you that, it'll take a year to get over it, which is a long time, a year to be in pain, to not be able to have full range of motion. So when it comes to frozen shoulder, for TCM, we are very good when it comes to pain, to anything that has to do with musculoskeletal, right? So today I'm going to look at the frozen shoulder from a perspective of menopause and perimenopause. However, this protocol that I'm going to share with you can be used for any frozen shoulder at any time for anyone. It's not just for menopause and perimenopause, but I did want to correlated because that's what I've seen in practice for many years. Does that make sense? Okay, so if you are here for the replay, all the links will be in below. And so if you need any links, it's below. If you're here for the replay, thank you for coming. And the people that are live here with me all over the world, woohoo! You guys totally rock. And I know it's late in some people's house, or it's really early in some people's place. So let me share my screen and we're going to start the presentation. Awesome. Okay. So let me see how we're going to do this first. Okay, that works. All right, so let's start it up. First of all, I just wanted to say that when it comes to frozen shoulder is common during menopause. Why? Because in the Western lens or Western medicine perspective, we have the estrogen that is declining, right? And when estrogen declines, there's a loss of collagen, and it affects the connective tissues elasticity, which also increase inflammation. This is why I recommend patients to take collagen on a regular basis, specifically when we're starting to age, because the amount of collagen in our body is going to decrease more and more and more. So we have a lot of option when it comes to collagen supplement. Most of the time it comes in powder form. It can come from the sea or from the earth. Okay, so that's the first thing. The second thing is, because the estrogen declines, often the shoulder capsules tightens and inflames. Specifically, like I said, when we first started, from 45 to 55 years old. So very common at that stage. Let me just look at... Belle says, it's the first time I see you without rings. I think I was going to pull the hair on my head when I couldn't start the live stream. I literally was starting to want to cry and pull everything out of me. So no rings, but still my hair is still looking okay, right? Okay, so continuing with the frozen shoulder that is common, let's look at TCM perspective. We looked at the Western perspective, why this is happening. Let's look at the TCM perspective. There is, as we know, as we age, a decline of kidney yin, kidney yang, and kidney essence, or jing. So when there is a decline in kidney yin, kidney yang, and jin, there's going to be poor nourishment of the tendons, the ligaments, and the joints. And we start seeing this with patients that starts getting arthritis or osteoarthritis, right? There's a breakdown of the body as kidney yin and kidney yang and essence is starting to be depleted because we are aging. Now, what's interesting is in menopause, often we think, oh, that's the only problem. It's a kidney yin, kidney yang. But it's a lot more than that, right? It's not just that. There's also going to be often a qi and a blood deficiency. So when there is less qi moves blood in TCM, right? So if there's less qi, there's less movement of blood, right? Because it's tired, it's weak, so it cannot move blood as much. So there's less blood circulation. And if there is less blood in general, there's less blood circulation reaching the muscles, the tendons, and so there's more stiffness. Also, this is very common in women, specifically around that time, specifically in perimenopause, to have very, very heavy menstruation. And so it leads to blood deficiency because they bleed so heavily. I had patients that have come to me and it's like the blooding. It's so, so bad. So that also often leads to blood deficiency. Another thing that can lead to qi and blood deficiency is in their 40s. A lot of women who have tendency to overwork, overdo everything. This is when women are high in their career or they're raising, a lot of children and they're really busy and they're starting to decline with age, but they're still pushing really hard. I've been guilty of that one. I don't know if you've been guilty, but I've been guilty of overdoing it in my 40s a lot. At one point, I was like teaching at 2 different colleges, owning a very large multidisciplinary wellness center with a lot of people in it, and having a full-time practice, and thinking that everything was easy. And no, I burned out. So I think we understand where the qi and blood deficiency can come from. There's also a liver involvement in TCM because there is liver blood deficiency that is going to occur because liver is in charge of tendons, joints, ligaments, right? And it brings a lot of good blood. Remember, liver stores blood in TCM for menstruation, but also to bring blood circulation to all the joints, ligaments, and tendons, right? This is why we know gallbladder 34, which is the pair organ or meridian of liver, is one of the best points when it comes to all the sinews. So liver is involved as well, specifically because it's affecting the ligament. So there is a liver qi stagnation. The more stressed we are, the more liver qi stagnation we're going to get, which leads to more dryness, more contraction, more stiffness that is going to affect the joints in general. Now, we also see carpal tunnel. That is very common at that time as well. I see a lot of carpal tunnel at pregnancy as well, because during pregnancy, there is a deficiency for a lot of women of blood. There's a lot of women that are anemic during pregnancy, right? That's why they usually take supplements. So that also comes up a lot during pregnancy. I'm talking about carpal tunnel. With menopause, it's more of a shoulder issue. Interesting, right? Okay, so now before we continue, I'm just looking here and you guys are paying super attention. I love it. Okay, so now I'm going to go and I'm not going to waste your time. We're going to go right into the acupuncture points because there's no point going and taking time. I want you to get the best out of this live. It's not going to be a long live, but it's going to be packed with great information. And if you have to go, you can watch the replay. It'll be back on YouTube tomorrow, so you don't have to worry about it. Okay, local points. That's the first thing we want to do is local point around the shoulder. Let me just escape for a second. Oh, okay. Here we go. So when it comes to the shoulder area or the shoulder joints, right, anything that's going to be around this is key. So I'm going to look at the points, but the most common points are going to be the eyes of the shoulder, which are large intestine 15 and Sanjiao 14. When you abduct your arm, you have 2 little eyes or 2 little indentation, little wells, if you see, right, on the shoulders here. So we have large intestine 15 in front of the acromion or anterior and the Sanjiao 14 posterior. Those 2 have to be there to help with the mobility. We're going to put Jianxian, and I'm going to share the PowerPoint in a minute, but we're going to put Jianxian. Jianxian is the one that's located between the anterior axillary fold and large intestine 15, so halfway through. So this is a really good point. I love this point because it really often, when there's frozen shoulder, this area where Jianxian is, It's very tender. Like, so I will palpate and ask the patients where the most tender area is, and they'll go, oh yeah, right there, oh, right there. This is Asher point, right? This is where we want to actually do treatment as well. So that's going to be for more like the top of the shoulder and the front of the shoulder. Yes, you can add up gallbladder 21, of course, because often when the shoulder is frozen, the whole traps, everything up in the shoulders is going to be very tight, very tense. We can also do points in the back, small intestine, 9, 10, 11, which is really good on the scapula to try to relax the back of the shoulder. So that's really the closest that I could see that I could use in order to be on the local area, right? That makes sense. Now, we don't need to have like all points, but it's good to know that those are probably going to be your most popular one. Is that how we say it? Popular one. Okay. So let's continue this. Okay, so as I said, large intestine 15, large intestine 14, Sanjiao 14. I didn't mention large intestine 14, but that's the one that's at the insertion of the deltoid. So that's a good one down between the triceps and the biceps. So that's a good one to add up. And then we said the one in the back, which is small intestine 9, 10, 11. And we said Asher point, right? Where it's really tender. And we try to needle where it's going to be more tender. Now, that's a lot of points. I wouldn't do necessarily all of them. And if you have a patient that is going to lay down on their back, I probably would do more of a front treatment if the pain was a little bit more in the front. And then we're going to look at other things we can do when we sit the patient up. Now, if the pain is more in the back, then you can face down and do more back point. And of course, the large intestine along the arm, you can add those up, and the Asher point, okay? We're going to talk about the whole treatment in a minute, like how we go about it. I'm just going to give you the points first, okay? Sorry, I'm just going to, here we go. Here we go. Okay, yes, thank you. Okay, so now let's look at the other points, which are the distal point. I love to use distal points because I think that sometimes you can't put a lot of points on the shoulder because it's so painful that the person or the patient may not want you to overdo it at the beginning. Eventually, you'll be able to, but this is why distal points are great. Also, distal points are going to reinforce your treatment, right? So we are going to do, of course, the 4 gates, which are large intestine 4, liver 3, called 4 gates because they're bilateral. People always ask, why is there 4? That's 4 needles. It will help with relieving pain. Li4, best point to relieve pain. And liver 3 moves chi, and chi moves blood. And large intestine 4 moves blood. So together, they're really good for bringing blood circulation. They're distal points, so they work very well. As you know, stomach 38, which is on the lower leg, is the best point for distal point, I would say. So best distal point for shoulder issue, any kind of shoulder issue. So for frozen shoulder, of course, we have to do stomach 38. I always do it on the opposite side from the shoulder that's affected. I don't do it on both sides. I only do it on the opposite side. Does that make sense? So we're going to needle it. And then what I do, I'm going to show you in a minute, is I do stimulation and ask the patient to slowly do the pendulum. I'm going to show you this in a second. We want to do spleen 6 to nourish kidney, liver, and spleen, because if there is spleen issue connected to muscle, liver connected to ligament, joint, and tendon, and kidney connected to bones. This is the whole shoulder girdle, right? Plus, all 3 are affected if the patient is going through menopause, perimenopause, etc. Right? So this is going to be really good to nourish blood, nourish yin, and really help the underlying deficiency. And then, of course, like I said earlier, we want to do gallbladder 34 because it is the best point for 2 reasons. The first reason that gallbladder 34 is the best point is that it is going to be the best point for joints, ligament, and tendon, first one, right? Second of all, I usually do it on the opposite side as well, because it is on the knee joints. And if you're doing balance method or master tongue or Dr. 10 balance method or master tongue holographic or mirroring acupuncture points, gallbladder 34 is a great one for shoulder issues. So because it's at the knee, but again, I would do it on the opposite. So let me tell you how I go about the stomach 38, because I just mentioned that, right? So when I do stomach 38, I will leave the treatment. Let's say we're doing a front treatment, and then I'm doing my points here, my points, distal point, local point. And then I will put stomach 38, right? And I'm going to leave the patient. I usually leave the needles for about 30 minutes. Now, we could also do electrostimulation. I don't like to do electrostimulation on frozen shoulder. I think it's too strong, specifically at the beginning. So that's my preference. And so I leave the patient in a parasympathetic state, relaxing and enjoying the treatment. Then I come and I can take all the needles out. Now, before I needle, I do other things, and I'm going to walk you through every step. But let's talk about stomach 38, sorry. So once I took all the needles out, we've got stomach 38 left in the opposite leg of the shoulder. I am going to sit the patient up. Okay, so the patient's going to be sitting up, no needles on the upper body, just that stomach 38 on the opposite side. I'm going to stimulate it. Let me take a point. So I'm going to stimulate it gently, just like this. Just very gently like this. Very gentle. It doesn't have to be big or deep. It's very gentle, but very rapid. And I'm going to do this. As I'm doing this, I'm going to ask the patient to slowly do the pendulum. So the pendulum is like, you know, when you have a pendulum like this, like it's like, I'm going to show you. I have to stand up on this one. So we're just going to, you know, that's a pendulum, like back and forth. That's a normal one, right? The patient with frozen shoulder cannot do this. They cannot do that. But they're going to stand this way. And then we're just going to ask them to just move a little bit. And even if it's tiny little bit as we stimulate, right? So the idea is to just slowly do a little bit of range of motion, just a tiny bit, right? To see how we go. And then we stimulate. And as we stimulate, we don't want to go where it hurts. Okay. We don't want to go too far. We just want to do a little bit of the pendulum and see if we could do a rotation. Now, the rotation may be very small, and then it may be very slow at the beginning. But the idea is to, every time we do a session, we get bigger range of motion, bigger pendulum. Yes? So I'll do this for 2 or 3 minutes and then take stomach 38 out, and we can relax. Okay? But those exercises are important, because if we keep the joint mobile, it is not going to find its way again, right? If you don't use it, you lose it. So we need to slowly increase the range of motion and get some movement in the air without pain. If it's painful, it's too far. So it's okay if it's very minimal, right? If it's very minimal at the beginning. Okay. Let's continue with this. Sorry. There we go. Okay. So it always asks me this. Those are the ones we're going to do when it comes to distal point, and we talked about stomach 38. Now, let's talk about TCM diagnosis, right? So we said at menopause time, there'll be an underlying kidney yin, kidney yang deficiency, some blood deficiency, which could be also essence deficiency, etc. So that we know is there. At the same time, the pain, specifically at the beginning, the frozen shoulder pain is really, really strong. So that's a qi and blood stagnation, or qi and blood stasis. The pain is worse with movement, the pain is worse, not worse, worse with movement, and it's in a fixed location, right? That means it's stagnation. So again, we want to put heat in the area to start to slowly get some movement. We also have to know that it's often a B syndrome. So frozen shoulder is part of B syndrome. B syndrome is any joint, ligament, tendon that is affected by external pathogen and gets worse with that. So for example, we can have heat B syndrome, which makes it worse. Heat makes it worse. We can have cold B syndrome, which cold makes it worse. We can have damp B syndrome. Dampness makes it worse. With frozen shoulder, it's usually a cold damp. So we need that circulation. So what happened with cold? Cold congeals. It stops circulation. Damp is sticky, so it stops circulation. So those two are going to create heaviness, feeling cold, or worse with cold weather, and cold at night or at nighttime. It's going to get worse, right? So when there is cold and damp weather, like in Vancouver all the time in winter, that is not going to help the whole diagnosis or the whole shoulder. So in Vancouver, we see a lot of frozen shoulder because we have a lot of cold and damp weather. Lucky us! But everything is green here because we get a lot of rain. So I just wanted to say that because of this, we have to take in consideration the pattern, because we always want to do the root and the branch, right? The root is the underlying deficiency, right? Obviously, the cold, damp, B, and the blood stagnation. The branch is where the pain is. That's what we talked about earlier when we focus on the symptoms, which is basically pain. We're going to treat the shoulder locally and distally. But we also have to do the root, which is the pattern. If we don't treat the pattern in TCM, then we're not doing real TCM, right? Chinese medicine is all about treating the patient uniquely. Now, the patient may have other patterns. They may have other patterns. They may be spleen qi deficient. They may have liver qi stagnation. They may have liver yang rising due to other things in their life. But we want to focus on the pattern affecting the shoulder. Yes? Makes sense? Okay. Now, for people who are watching the replay, I take my glasses off and I just wanted to look at the chat. Kara, do you have experience with stomach 24 and 26 as 4 gates in an abdominal acupuncture? So abdominal acupuncture is very different. There's a lot of abdominal acupuncture to answer your question, Belle. Okay, let me do this because here we go. There is a lot of abdominal acupuncture. There's the turtle one where it looks like a turtle that you can have in the belly. That's like a microsystem, like the ear microsystem. Stomach 24, stomach 26 as opening the gate in the abdominal region. I have heard of it. I've never used it in that context. So it's something I'm familiar with, but I've never used it in that context. So I just wanted to answer. So you retain stomach 38 for the 20 minutes treatment. Linda, I usually do a 30 minutes treatment, never less than that. That's me. But yes, I retain it. Then you stimulate. Yes, I do. Do they do this on all the table? I've been worried to ask them to sit up with stomach 38 already. Oh, yeah, no, that's a great question, Linda. So here's the thing. The patient's laying down. Let's say I'm laying down on my table, right? I have a table where I can lift the back. When you have a hydraulic table where you can lift the back, so it just kind of like, and they're sitting up, and then you can stimulate, but they're sitting up. So yeah, if you don't have a hydraulic table, that makes it more difficult. I totally understand that. But it's not so hard to have to help the patient sit up, right? And kind of sit there with their leg dangling, I guess, on the side of the table with one needle in. But if you feel like that's uncomfortable, because it would be uncomfortable if they move, take the needle out, make the person sit up because you don't have the hydraulic table, and then put the needle back in and then stimulate. You could do that too. I think that would work just fine, right? So yes, I forgot that not everybody has hydraulic tables. How do you solve the situation when you follow the treatment according to Tiangen and the patient's meridian is gallbladder channel? How do you solve the situation? If it is gallbladder channel, or if it's, then we're talking about holographic. We're talking about mirroring, right? Gallbladder channel will be affected. The large intestine will be affected. So it depends what method you want to use, right? So if you're going to use a holographic method like Master Tong or Dr. Tan, then you're going to stick to that. If I'm going to use what I'm sharing today, which is treating the pattern in a classic acupuncture way with local and distal point like root and branch, then that's what I'm going to follow. That's what I love about TCM and treatment is that you have to use the way you like it better. Some people, my friend Sonia Tan, 99% of all her treatment are the Tan balance method. That's all she uses. That's what she loves. She's passionate about it. She knows it so well that she teaches it. She's amazing when it comes to that. I'm very classic acupuncture. I know a lot of acupuncturists that do 5 elements, and they love using 5 elements, and that's what they use. So it all depends on what you resonate with, I think. Excellent. How would you apply Moxa on frozen shoulder? Oh, we're coming to Moxa, Denise. So I'm going to answer your question. We're coming to it. So when it comes to, okay, hold on. I'm going to share my screen again. Here we go. When it comes to those patterns, so let me finish on this and then I'll answer your question, Denise, okay? Beautiful. Okay, so we have looked at those patterns, the Qi and blood stagnation, the B syndrome, and the underlying deficiency. This is when we want to probably address this. So bladder 17 on top of the 4 gates is a great way for blood stagnation because it's a really good point for blood stagnation. Now it's in the back. So again, you have the choice to do 20 minutes in the front if you want to, 20 minutes in the back, or you could do a front treatment one session and a back treatment the next session. You don't have to put all those points. If you're doing a front treatment and you're doing liver 3, large intestine 4, you probably don't have to put bladder 17, right? Because they really move Qi and blood. When it comes to cold, damp B syndrome, then we want to add up spleen 9. Gallbladder 34 is also a great point for the dampness, so that works really well. And then we want to do Moxa. So I'm going to talk about Moxa in a minute. And then we want to address the underlying deficiency, the blood deficiency, the yin deficiency, the kidney deficiency specifically, if it's during perimenopause and menopause, right? So we would add up kidney 6, stomach 36, best point to tonify Qi and blood, right? Spleen 8, liver 8. I don't know why I have spleen 8. I meant to say spleen 6, but it says spleen 8 in there. So I meant to say spleen 6 and liver 8. So let me correct that. I'm going to change that. This is what you do when it's live. It's fantastic. I'm going to change that. And here we go. I don't know why it says 8. It should say 6. Okay, we're back. So when it comes to this, yes, we're going to do spleen 6 and liver 8 to nourish the blood, nourish the yin, kidney 6 for kidneys specifically, and stomach 36. Now, stomach 36 is also really good because it's going to help the healing process, right? Plus, it's opposite from the shoulder on the knee. Again, it's very holographic. So I love that. That is a lot of points. You don't have to put all those points. So what I like to do is do the local on the shoulder, do the distal, like the 4 gates, the stomach 38 specifically, and gallbladder 34. Now, I would put spleen 6 on both sides, but I wouldn't use liver 8 then. Or I would do liver 8 on both sides and not spleen 6. Like you could pick. You don't have to pick all the points. Does that make sense? Okay. Those are always a guide. You always have to follow your intuition when you treat your patients. Some patients really do very well with a little bit more needles. Some patients do better with the least amount of needles. Everybody is different. Have you ever treated people with fibromyalgia? Fibromyalgia patients are very different, right? Some of them love acupuncture and love massage. Others do not like to be touched. It's like, oh, it's so painful, right? The needling, even the massage, they can't take anything. Their parasympathetic, their central nervous system is so heightened that they just can't relax. So you can barely touch them, right? But some other fibromyalgia patients, you could totally massage them. They love it and do acupuncture. This is the same for anything. Follow your intuition. See what resonates best with patients. Ask patients. Communicate with your patients. Say, oh, is this okay? Do you like this? Do you not like this? I have patients that will tell me, can you do that point? I love that point. It makes me feel good. And it's not just yin tone, right? There's a lot of points on the body. Like I have patients that will tell me, I do not like kidney 1. It really hurts. Oh, look at that. Well, that was funny. See, technology, fireworks. I do not like kidney 1. It really hurts, but I love the effect it does and what it does for me. So they will ask, that patients always ask me for kidney 1. So interesting, right? So really communicate with your patients because they can feel what they need as well if they are very aware. That I absolutely love, that time that we spend with patient to really work together. Yes? Okay. I got you here. Okay. We're good? You're still with me? Okay. I'm going to give you a whole thing coming up. I'm just looking at, yeah, Denise, I'm coming with the Moxa in a minute. Someone says, could you turn on the subtitle in your video, please? You can turn them on. I cannot. It's in the little setting, and you can actually click that little setting, and hopefully they can go on, but they might not go on for live. I think they might not work for live. They might work for the replay. I'm not really sure because that's a technology thing. I don't know. Do you have better results of stomach 38 with a different side of pain? I usually use the same size and good results as well. Yeah, and I mean, I'm sure using the same side would work too. I like to use the opposite side because the opposite side is stronger. It has more chi, more blood, because on the side affected, there's less chi and blood. That's my reasoning. But if it works well for you on the other side, on the same side, by all means, right? I love that. Usually, how many sessions to be pain-free? Yeah, that's a great question, Denise. I'm coming on that too. So we're going to talk about other things because we can't just do this. There's a whole little process we're going to talk about. But usually for most patients, if they come twice a week and they follow what you tell them to do, the recommendation we're going to talk about, including food and supplements, usually about 2 months, so 8 weeks, it's really good instead of a year. Now, if you see them 3 times a week, it'll probably go faster. If you see them only once a week, it's going to be longer, right? Acupuncture is like, when you're in pain, the closer the treatment, the more treatment we do, like 3 in a week, if it's possible. It's not always possible, I get that, but we have to do at least twice a week. And we should be about, most of my patients over the years, it's been about 8 to 10 weeks, depending on the patient. So it makes a huge difference instead of, a year. So yeah. Okay, we're good? Okay. So I know I'm talking about frozen shoulder in general, but also during menopause and perimenopause. If you haven't checked out this course yet, I really, really am proud of this course. I haven't taught a long, continuing education course in over 4 years. So this is really close to my heart because my mom went through menopause and it was horrible. It was really hell. And for me, I went through menopause like it was nothing. And I share that whole story, my mom's story and my story in the course as well. And I wish I had my knowledge to help my mom at the time, but I was a kid. So that wasn't possible at the time. But I know a lot of women suffer from menopause and perimenopause transition with a lot of symptoms. It's just a transition. However, the support is not really, really great in general. And it's full of symptoms that women don't know what to do with. They feel like they're not themselves. They gain the weight, all this stuff. I'm going through all this during the whole course. So if it's something that, really speaks to you, like it speaks to me, I literally would love for you to check it out. The 7-day money back guarantee, you get 4 CEUs after you pass a quiz. You have 6 modules. I go through everything that women go through menopause and give you all that you need in order for you to help support women going through this transition that have difficulties and don't get a lot of help in general. So if you haven't checked out the course yet, I think the link is below. It's on my website as well, acupureacademy.com, and you can go to the TCM course tab, but it'll be also below in the link below. So check it out because I'm so, so happy about this course. Because think about it, 50% of the population that live to 50 will go through this transition. So it's a lot of people. And, I see a lot of women that come and see me for, let's say, insomnia or frozen shoulder for that matter. They don't necessarily come for menopause, but then you start asking questions and, oh yeah, I've had night sweat for so long. Oh, my focus is so bad. But they came for something different. Well, we can address this because now we know what to do. We have all the tools in order to help the patient. Yes? Okay. So let me go back to the frozen shoulder. Okay, but I wanted to mention this because I think this is very, very useful course. Okay. Tui Na. Do you guys do Tui Na? I love Tui Na. So Tui Na is Chinese massage. It's one of the things that not everybody learned, but I absolutely love it. The best thing to do, and I'm going to show you in a minute, is to do some rolling and some kneading over the deltoid and the scapular muscles. Then we want to do passive mobilization, which is what I talked about earlier, which is the gentle pendulum movement of the shoulder to improve the range of motion, right? Also, we want to do some cupping, local cupping around the shoulder area for about 5 minutes. And I'm going to show you what we're going to do with cupping as well. So I'm going to show you the whole process, but I wanted to talk about it before. Lifestyle advice, the first one is gentle daily range of motion stretches, pendulum swings, and wall walk. I'm going to show you what that looks like. Heat therapy at home, so like a heating pad, right, for the stiffness. And of course, we do not want the person to stop moving. It's important they go for a walk, so their body is moving, so there's circulation. It's really important, right? If we don't move it, we lose it. Frozen shoulder in menopause is never just orthopedic, meaning it's not just the joint. It also reflects the local stagnation, of course, but the systemic deficiency. And we said the deficiency is the yin deficiency, the blood deficiency, right? And obviously the decline of Jin essence. Okay, so let me show you now and share the entire process step by step. If you have a notepad, this is the time to take notes. Okay, so the patient, we do the consultation, etc. Now it's treatment. I am going to first start by doing Tui Na. I start with Tui Na. Now, kneading and rolling. If you've never done rolling or kneading, then you don't know what that is. This is rolling, right? This is like rolling. And then kneading is kind of like when you squeeze. So I'm going to squeeze the shoulder. I'm going to interlock my fingers and I'm going to go over the shoulder girdle. So you put your finger or your hand, one is in the front, one is in the back. Can't do that on myself. And then you're going to go over the shoulder. So that's like that. Let's say that's the shoulder, right? And I'm going to go like this, back and forth. Hopefully the mic doesn't. I'm going to go like this, but the shoulder is going to move, right? So it's going to go back and forth, back and forth, back and forth like this. So I'm going to do a little bit of this over the shoulder, and then I'm going to grab the shoulder and I'm going to lift. So it's like grab, lift, gentle, gentle. So look, the person's arm is down, but we're lifting. Gentle, release, gentle, release. So if you do Tui Na, this is going to help a lot in loosening up everything. So once I finish my Tui Na, I will do a little bit of cupping. So you have two choices. You can do moving cup, meaning you need some oil in order to move the cup, of course. And you can do a little bit of cupping in the front, very gently, and specifically in the scapula area and the traps, right? So I like to move it. I will do the traps up here, up and down, the scapula a lot, the deltoid in here, and then maybe a little bit here in the anterior deltoid area with a smaller cup, right? I like to move my cups. I found it's like a deep massage, right? And of course, check with the patient. If it's too painful, take it back. You can put cups and static cups directly and wait 5 minutes and take them out. I don't really like that method. I like movement because the whole point of the frozen shoulder is we want movement, right? So I'll do the Tui Na. Second step is some moving cup all around. So now we got lots of circulation in this area, right? Then we can needle. We do our local needle, our distal needle. Then we take all the needles out after the treatment is done. And we do the stimulation of stomach 38 with the pendulum, like we said, the circle and the up and down to see how much we get or how much range of motion we get compared to the beginning. If the patient is feeling pretty good, then I go back and I do more Tui Na. So I go back with my fingers and I lift and I rotate back and forth. I go all the way down, all along the arm, all along the scapula, all along the trapezius area. And I will do about 5 to 10 minutes, not longer than that, right? Maybe 5 to 10 minutes of Tui Na. Woo! So that's the whole process. Now, if everything gets worse on cold, right, we can add up Moxa. So there's two things. If everything gets worse by cold, while the patient is laying down with the needles, I might have the heat lamp above the shoulder. So if you put the heat lamp above the shoulder, the whole shoulder is going to warm up. It's going to be great. If you want to add up Moxa, to it, which you could, right? Specifically if it were worse on cold, then I will use a moxa stick and I will just go around the shoulder, around the points, as in indirect moxa. So not direct, not on the needles. I won't do it that way. I will do just the moxa sticks and go around the needle for about 5 minutes. And that's about it. I don't do a lot of moxa for shoulder. I do a lot more Tui Na, cupping, needling. So that's my favorite. But I like the heat lamp because I feel the heat lamp is very useful, but you can add up moxa. I hope that answered your question, because I know you had the question about moxa and the whole process. So you see my process step by step, yes? And we finish with more Tui Na. And if you do this twice a week, I promise you, it's so amazing that the range of motion gets bigger and bigger until the person can actually put their jacket back on. It's like, whoa, acupuncture rocks. Okay, let's continue because there's more that I wanted to add to this. It's not just about acupuncture and physical therapy, although it's really important and it's going to be the most of what you need to do, right? So we've talked about this and the range of motions that, is going to increase. Just wanted to look. Okay. Can we watch this later? Yes, you can. There'll be a replay. During the Tui Na or the cupping, do you follow the flow of chi of the meridian or not? Ooh, Belle, that's a great question. I love that. Yeah, so when I do Tui Na, I don't follow the meridian. I really try to bring a lot of circulation. For cupping, yes, I like that. So I will go up along the large intestine meridian, up along the small intestine meridian, right? So it's kind of like on the way up instead of on the way down. Yes. I use gua sha because it's easier to get places that cups do not. And you're right, gua sha can be really good for this. And that's a great other tool that you can use. I don't use it a lot for frozen shoulder, but that's just me. I use it a lot more for the neck part of it or the traps to really loosen up the traps more than the shoulder itself. But I love gua sha, so great reminder. Thank you so much. Okay. We need to talk about nutrition because nutrition is at the center of our health. And it's called Zhong-Qi for a reason. Z-H-O-N-G. Zhong-Qi means middle qi. Middle means it's in the middle, in the center. It's a digestive system, right? It is literally at the center of ourselves. If you look from Du20 to kidney 1, spleen and stomach or the digestive system is right in the middle for a reason, which means if it is at the center of us, it's at the center of our health. Physical, emotional, and spiritual. And for some reason, that's the hardest thing for people to want to make change about, right? Because it's food. So we want to nourish food. We want to have yin nourishing food because there's a lot of yin decline, right? We know that. And then it's not nourishing to the joints. So specifically, yin nourishing foods are going to be lubricating. We need lubrication, right? Because there's stiffness. So black sesame seeds, seaweed, salmon is really good. Flaxseed oil, pears. You can use spinach as well. Anything that is going to be cooked. I'm not talking about raw spinach. I'm talking about cooked spinach, cooked seaweed, right? Anything that's dark is going to be great for kidney. And also anything that's going to be nourishing food is going to be lubricating. So even almonds and nuts and seeds. Now, kidney supporting foods specifically for kidney essence or jing, bone broth. And again, this is affecting the joints and the ligaments and the tendons. So bone broth has a lot of collagen into it. And we talk about this at the beginning. Collagen is great for women as we decline or we age, collagen declines as well. So walnuts, great for supporting the kidneys, bone broth, black beans, chestnuts, blackberries, and any kind of seed, specifically black seeds like chia seeds, sesame seed, and pumpkin seeds, very good in magnesium as well. So that's really good. We also want to limit a lot of raw cold food. Why? Yes, the spleen doesn't like it. We know that. But cold congeals and it stops circulation. And we need circulation. So we're not going to have a lot of cold raw food or drinks. That's not going to help. Greasy, sugary food is going to create more dampness. Dampness is sticky and it stops circulation as well. And it creates more inflammation. So let's take those down. Now, when there is yin deficiency, right, there's a little bit of a deficiency heat. So adding more spicy alcohol or coffee is going to make it worse. So we try to ask the patient to kind of limit that, because also alcohol and coffee doesn't help the estrogen level, which we know during perimenopause and menopause is declining. Okay, so the goal here is to preserve the bone, the muscle, and lubricate the joints, right? We talked about this in the TCM perspective. Now, in a Western perspective, it's really important for the women specifically to keep that bone, muscle, and lubricating joint to have enough protein. So usually it's recommended in Western perspective, 1.2 to 1.6 gram of protein per kilogram per day. What does that mean? Because as we age, our muscle mass is going to decrease, and that also lowers our metabolism, which nobody likes. So we want to really preserve muscles. And so doing obviously weight-bearing exercise is great, but also having enough protein in the diet. So 1.2 to 1.6 gram per kilogram per day means that if you use kilogram in your, what do you call it, in your country, then if a woman is 70 kilograms, 70 multiplied by 1.2, 1.6 gives you kind of like 75 to 100 grams of protein per day. If you use pounds, let's say a woman is 150 pounds, you divide the weight by 2. So that would be 75. And then you multiply this by 1.2 to 1.6. Again, that would give you about 75, 80 to 100 grams of protein per day. Salmon, a little piece of salmon can have 30 grams of protein. It's very quick to have enough protein in the day, right? So we can have fish, chicken, legumes, eggs. If the person eats dairy and they don't have a lot of dampness, then Greek yogurt is great because it's high in protein. However, it is also a bit damp, like all dairy. So we have to be careful, okay? So we have to be aware of that as well. Okay, so as we said, we want to really try to heal the joints, right? So we want enough calcium in a diet, and that can come from dairy. Again, dairy may not be the best. We can come more from salmon, sardines, anything that has the bones. The bones are going to have the calcium, right? So you can have bone broth as well. You can have leafy greens that are cooked. That is high in calcium, like broccoli, spinach, kale, that is high in calcium. Vitamin D, we live in Canada, so we don't have a lot of sun in winter. We definitely need vitamin D, which comes from sunlight, but often we're going to need probably supplement. Food that have vitamin D, it's not very high in food, unfortunately. Mushrooms do have it, like maitake, shiitake mushroom do have vitamin D. Salmon has a little bit of them, but most of the time has to be coming from a supplement, unless you live in the sunshine and you have sunshine every day. Lucky you. Magnesium, very important to relax the muscle, for the joint, for all the health of that whole musculoskeletal. We can get nuts, specifically almonds are great, high in magnesium. Seeds, legumes, and whole grain is high in magnesium. What's that? Also, quinoa. Quinoa is really high in magnesium, as well as avocado, for example, very good as well. Omega-3. In North America, we eat a lot of omega-6, and there's a imbalance of ratio between 6 and 3. We don't get enough 3, and we get too much 6. So canola oil, vegetable oil like canola oil are very high in omega-6, but we don't get enough omega-3. So olive oil is much better for that. It has higher omega-3. It still has omega-6, but omega-3 comes from salmon. Again, if you don't like fish, that's a bit of a problem. Chia seed, walnuts, mackerel. So that is going to give you, a lot of fish will give you omega-3. Let's talk about supplements. So I talked about collagen at the beginning, and I want to reinforce that, having collagen supplement as a woman age is very important, because it's going to lubricate the whole joint, ligament, tendon. Okay, so when it comes to collagen, there's a lot of different kind. It's always good to try to get lab tested collagen that is good source. I like collagens from the sea, by the way, so that's something that I like to see a little bit more. Okay, so when it comes to supplement, we can also recommend, or not, but patients are going to ask us question. But if you are going to recommend supplement, calcium, it's a good idea, specifically about 1,000 to 1,200 milligrams a day. But vitamin D is much more important. So at least 1,000 international unit per day is really important. And if we're taking vitamin D, it should be vitamin D3 with K2, okay? For better absorption. It should come with K2, D3 with K2 for better absorption. Magnesium is crucial. I think every woman should take magnesium all the time. So 400 milligrams per day, at least, this is very, very key. And then we talked about omega-3, right? So if people don't like fish or they don't want to eat salmon or anything that has, a lot of omega-3, they're not really keen on eating that food, you can take the supplement if it's good source, 1,000 milligrams per day. However, it's great to decrease inflammation, but however, we have to be monitoring because if the person is taking blood thinners, omega-3 can increase the bleeding risk. So we have to be careful about that. See, this is why it's really important to understand and know supplements because we always think, oh, the supplements, right? But they don't always play well sometimes with medication, right? And so that's kind of interesting because in my menopause course, I talk about this and all the stuff that patients come in and say, oh, I'm taking this, but then they have on this medication. Oh, I'm taking that, but they're on this medication. I'm like, those two don't play well together. And knowing this is really great to educate your patients because sometimes they don't tell the doctor they're taking some supplements because they read it on the internet and it doesn't go well. So omega-3 supplements and blood thinners, not quite great, right? So it's good to know those things. I hope that was really useful. I really, really wanted to thank you for staying when I was having difficulties getting on. You are the best. You are TCM rock stars. I value your constant love, everything you send me every day. It just makes you make my day all the time. You send me such great messages and DM and comments, and it makes me want to continue to provide a lot of really support for you and in turn for your patients, right? So let me look at if there's anything else I missed because we are here so I can answer questions. Okay, let's see. Do you use the heat lamp with the needles in? Yes, I do. Yes, Katie, I absolutely do. I always put the heat lamp above the needles because the heat lamp will warm up the needles and the needles will be a great conductor to bring the heat in. So yes, absolutely. I recently had a frozen shoulder patient. I used a lot of the point you mentioned. The pain got worse. Oh, they stopped coming. Is this because acupuncture thaws it and it's a necessary stage? That's interesting. So did you do Tui Na? Did you do any cupping or heat lamp, Linda, or just acupuncture? Because for some patients, it's really painful. And if you put the needles in and they feel like, oh no, it's too painful, then leave the shoulder free of needle at the beginning. Use Dr. Tan balance method, use holographic method to bring the patient in a parasympathetic state, to calm them down. Use the root cause, like the tonify yin, move blood, all distal points, just for the first session. Then the second session, try to add a couple of needles in here, see how they do, and slowly increase it. Some patients are very sensitive, right? So it's kind of like we have to play, and sometimes it's not your fault. It happens. Sometimes we're really going good with good intention, right? So, but if it's worse, you're right, they're going to be scared and then I don't want to come back, right? So if after the first session, they're like, oh my God, it was worse, then it was too strong for that person because maybe that person's really deficient. So we want to start slow. And that's why I like to start with Tui Na. If I start to do massage and do Tui Na here and they go, oh my God, I'm like, okay, that person's super sensitive. I'm not going to put a lot of needles. I'm going to start slow and we'll start distal. Does that make sense? Okay. What to do if someone is having frozen shoulder as well as diabetes? DPCA, that's not a problem. I mean, obviously there's diabetes type 1 and type 2. But I need all patients that have diabetes. That's not a problem for me. So, oh, look at that. What type of magnesium is best? I heard magnesium oxide is not good. Yeah, usually magnesium glycinate is probably the best to relax the body. So, or biglycinate or glycinate. You are the best. Regard from Ecuador. Ecuador, Jane. Wow, muchas gracias. I love it. I love that. Heat lamp and acu only. Okay. So yeah, so if you did heat lamp and acupuncture, Linda, then maybe just start slow next time and see how the patient responds. Denise is like, what Chinese herb do you recommend for each pattern? I usually, for frozen shoulder, I don't think it's very necessary to have herbal formulas unless you want to increase more circulation and have herbs where that increase circulation. But I found that the physical therapy is probably the best, and then reducing inflammation by having good healthy food obviously is important. Preventative obviously is good too, right, if we are doing prevention and we're in good health before, but obviously we're talking about when someone comes in with frozen shoulder. So I am so happy you guys were here. Thank you so much. I have to say, since I'm not able to speak myself, I started taking Ayurvedic golden milk. Yep. Yeah, absolutely. So, yeah, Belle, I love that. So, Ayurvedic golden milk is so good for anti-inflammatory because it's got turmeric in it, right? And if you use coconut milk, you can add up ginger, cinnamon, nutmeg. It's such a good warm winter drink, and it's really good to release inflammation. Cardamom and black pepper for absorption to turmeric, a good one. I love it. Thanks, Belle, for sharing that. I forgot black pepper. Marco, come stai? Bene, Marco, da Italia. I love that we have people from all over the world that come and join us. So thank you so much. Make sure you use my resource page on my website. You guys, I have so much. On my website, there's a search bar. And if you go and search something, probably I've written something about it and there's a video about it. So people always ask me, hey, do you have anything on high blood pressure? Yep, it's there on my website. Do you have anything on diabetes? Yep, it's on my website. So make sure to use that search bar for anything to support your journey, to support you and your patients. I thank you for coming today on this live. And I am just so humble by all the love I receive every day. So have a fantastic day wherever you are in the world. And no matter what, keep rocking it using TCM.